Good afternoon, dear colleagues. My name is Dr. Larissa Mila. I am cosmetic physician with approximately 100 years of experience. I'm specialist in life, I call it. It's a general practice where we more do continuous care rather than solving one problem. And as a cosmetic doctors, we do the same. We, unlike plastic surgeons who do one or two in life surgeries, see our patients regularly. Often it's more regular than their own GPs, and that's why we are more in a position to monitor them more effectively and prevent things. So today's topic, cosmetic concerns as the symptoms of underlying disorders. I have no conflict of interest. I'm from Vista Clinic Australia and M.A.M.I, Melbourne Aesthetic Medicine Institute, which is more standards research and trainings. So why it is important to treat the cause? Because we make our cosmetic outcome last longer, but also it preventative of the aging better. When patients come to see us regularly, and there's a lot of research about this, they do age better. But if we make overall aging not very fast, but make it like more slow, less aggressive, and also enhance their cosmetic outcomes overall, they will age better and better, like a good wine. The patients will be more and more attractive as they age. Also, cosmetic concerns is important for health and even saving lives. Like this 12-year research, which proven and officially presented since 2018, that forehead muscles are predictive factor of high risk of dying from cardiovascular disease, strokes, and heart attacks. And that's us, really. We're in a position to look when out of proportion to other aging signs and out of proportion to their age. They have mostly forehead wrinkles. It's a very good to discuss with patient that it possibly just fine, but it is actually non-association, and we ideally have to make sure that we do these checkups. We have a beautiful free of charge online tools. We even have Medicare item associated with cardiovascular check, and that might actually save lives just itself. So keep an eye on that. That's probably one of the most important, if you remember from this presentation, to check their heart health. Other wrinkle factors which are proven is photoaging and smoking. Smoking is not just percentage. Smoking is few times more wrinkles than non-smokers. Overall, wrinkles are two different causes, completely opposite to each other. One is hypertonic, too much muscle, and another is hypotonic, too little muscle. When we don't have enough muscle support, all the soft tissues drooping down, causing folds and giving the wrinkles. And obviously, muscle relaxant, definitely not a good idea there. What causing that? The most common under our control factor is lack of protein. As we age, we have less and less of protein itself, and for different reasons. And usually the first which goes is our small wrinkles, small muscles. That's particularly like a classic medical school, it's a claw. When we do the claw, between the phalanx, this very small kind of deficiency, it's more deficient there, less protein. And in the face, it's usually zygomatic, because it's a mid-face lifting muscles. When we have not enough protein, they usually become a bit more hypo, not too much trophic, and that's what causing this kind of droopiness as well. Another cause is a gut issue. That was proven for quite a long time ago, particularly from supplying too often food. It's like overload of too much. The gut doesn't have a rest time with no food when it can recharge and recover itself. We're all the time digesting, and that's why it causing lots of decompensation, such as leaky gut, IBS, etc. Dr. Meyer from 1950s has quite expensive luxurious retreats all over Europe. They still exist and doing well. Basically, they treat gut health based on just starve them, just intermittent fasting, eat once a day for 3 weeks, and they monitor the progress by how deep are nasolabial folds. Healthier guts, less nasolabial folds. As you can see, Dr. Meyer in this photograph in his 70s have pretty beautiful nasolabial area. And they even developed the system like a stages, and that's direct correlation. That's probably why, you know, when patients only do cosmetics for nasolabial folds, it has very limited capacity as well as longevity. So because it's very strong association with underlying bloating of the guts. If we just put them, eat once or maximum twice a day with no snacks, nothing, just give rest, give less bloating to guts, that itself improves nasolabial folds. Hypertonic muscles, we know very well, thanks to our pharmaceutical business. They make sure we all know how to do it, so I will not put too much. But one thing I still have to add, it's basically severity of hypertonic muscles is associated with dehydration. Less water and salt, more sharp and defined are crow's feet and other muscles, particularly when they use diuretics like coffee, hello from Melbourne, and alcohol, smoking, any type of dehydration. Just tell the patients, drink at least 2 liters of water, particularly with some kind of electrolytes to hold actually the hydration inside. If you ask me about efficiency, what is the most efficient method from diet intervention point of view, that's the only one which is proven. It's reduced meal frequency. Eat once a day, and that's proven and it's effective. After 2 months, your wrinkles will be less. If we're talking about others, they have a limited efficiency and evidence. So hormones is my favorite topic. I'm already here of education of advanced HRT. Recently, as you know, it's been eventually recognized in Australia and even PBS. Massive topic, massive. But let me generalizely outline. So hormones, the most potent are primary anabolic hormones such as peptide hormones, growth hormone, IGF-1, relaxin. They give the biggest, largest wrinkles like nasolabial folds, jowls, overall droopiness of the face. Smaller wrinkles like crow's feet, forehead, around the mouth, they are less potent anabolic hormones such as testosterone, different types of estrogen, progesterone, etc. Very, very small, tiny wrinkles, like almost texture of the face. It's usually hormones which associated with hydration, vasopressin and aldosterone, for example, and general water retention in the body. As example, this lady, usually when we see our patients, not 1 or 2 hormones, all hormones are going down as we age. That's why we can see usually all of them in most of our patients. In a hormonal area of frontal hair, that's usually classic sex hormones like testosterone and estrogen. It's a thinning of the hair as well as losing hair. Dry eyes associated with DHEA deficiency, which is like in a steroid hormones cascade, one of the pro-hormones. Oxytocin and all other sex hormones are with overall pale face. Aging in terms of sagginess, this droopiness, it's associated usually with growth hormone and thyroid as well. Dry skin, it's all of them. And progesterone and growth hormone with how firm is the skin, how elastic is the skin. This is obviously very generalized because if you look at structure, they're all very connected. But this is overall kind of how to assess. In terms of the most important hormone, of course, it's estrogen. Estrogen function in the body is attract. It's a beauty hormone. And in fact, in the 1970s, it was even abused because more estrogen, more attractive is the face, and that was abused. It's very hard for them not to do it, and it can be quite dangerous. So that's why we're not going to this abuse or overdose. We're talking about diagnosing estrogen deficiency. That's pretty much lack of volume in a hair. It's more pale face with less of redness in the cheeks. It's more masculinization of the face because testosterone is still being produced in the female body by adrenals, by other organs, but estrogen decrease. And that's why proportion look like more masculine type of hormones. It can be hair, it can be overall masculinization of the bone and muscle structure. dry eyes and skin. Smoker's line, or like in France they call them kisser's line, it's basically area around the mouth have a very high concentration of estrogen receptors as well as around the eyes. That's why we can look at eyes and lip aging, and we can see it's very strong association with estrogen deficiency. Estrogen is together with progesterone give overall all above and also skin elasticity, more firm face. And that's actually also safer because bioidentical natural progesterone with estrogen is protective against cancers also. That's why it's quite commonly used together. It's actually available through the PBS for patients who are deficient. Testosterone deficiency, females do have testosterone, it's very important. And because testosterone in a female body turn into estrogen, that's why the symptoms are very similar, but particular testosterone give thinning of the inner eyebrows. The inner part of the eyebrows is testosterone area. That's why when they have to be very thin, it might be suspicious for that. And muscles. Muscles are very sensitive to testosterone. That's why when they have not enough muscle bulk and muscle kind of tonus in mid-face particular, it also can be testosterone deficiency. I can talk a lot about hormones, but we have to keep it nice and simple today. Dark circles under eyes, very common concern, and by far the most common cause is, of course, genetic, especially with Mediterranean and Arab type of faces. But however, there are some things which do not miss, particularly iron deficiency. Very common. Iron is a collagen brick in skin. That's why it's very important to make sure they have enough. And just the dark circles with a very thin skin can be associated. Different types of allergies can be associated as well. And that's probably due to for time, I will not do too much. We do trainings, very short trainings for particular topics in Melbourne Aesthetic Institute and Vista Clinic. So if you would like some specific topic like how to practically inject this and that, just let us know. And if you have any questions about presentations, you're always welcome as well. Thank you so much for your attention today, and I hope you will have a great conference. Bye.